Well, I'm not sure I can summarize your question, but I think what you are trying to say is, why are we not very effective? What's the problem? And of course, it's almost like saying, what's wrong with us here? You know, what's wrong in America? Why are we not doing very well? And I mean, I have my theory, of course, and I'm sure that many will disagree with me, but I'll tell you the main issues. I think, first of all, we have, unfortunately, purged out the clinician out of the equation. So the clinician who is facing the tumors and the patients and seeing what happens to them is actually no longer on the table. Believe me. Those who call themselves clinical investigators are actually gambling. A versus B, I have no idea why, but let's try it. This is clinical trial. We call that clinical trial. That's not a hypothesis. A hypothesis is A should be better than B because A, B, and C. Now let's test it. If you put this criteria to our clinical trials in ASCO, I will bet you 90% plus will not have a hypothesis. It's just a guesswork. Okay, that's one thing. So the clinicians who are part of the war on cancer are not in the war anymore. They're actually on the side. Basic scientists are working hard and are competing very strongly, but their goal is to get a paper. Their goal is to get another grant to sustain their lab. So they are not necessarily focusing exactly on clinically relevant questions. They may be asking questions that may be relevant, may not be relevant. However, let's assume and give them the benefit of the doubt and say they are all very good and they are all producing good questions, good answers. If I told you the clinician is out, he's not listening, he doesn't know. In fact, not only he doesn't know, he cannot read your literature. This is the problem. There is a major disconnect in language. I tell you, if you listen to basic scientists, they don't understand you. And we don't understand them, most part. I'm talking clinicians here. We don't like to see gels. They don't like to see Kaplan-Meier curves. They don't know what it means. They don't know what a CAT scan looks like. So we have to explain, and we don't know what a gel should look like. So we have become so distant apart. We use different language. We have different appearance even. You go to the basic science meetings, you see people in T-shirts, in shorts, having fun and enjoying themselves. You go to the clinical meetings, all in suits on weekends. Here, look at me. I have a tie. He doesn't have a tie. So we are becoming two different populations, talking different language, not even interacting with each other. And then we say, why aren't we successful? Well, I mean, why should we be successful if we are like this? So the real issue is how do we fix this? And here we get into the money problems. Clinicians need to generate their salary, so they're going to be busy with their patients. They're fighting all their paperwork with insurance companies. They have no time to read anymore. It is sad to say that a drug rep is teaching the clinician. That's a sad admission. If a drug rep is now going to come to teach me, that's a problem. But that's what is their job now. They come to give you information. So that's a big problem. How do you fix that? You have to fix the economical system that is supporting the profession. You have to also bring those basic scientists to really be partners so that there's mutual respect. I respect what he says, he respects what I say. Not consider them crazy and they consider me stupid. You know, this is a problem because if there's no respect, it's easily discerned. I mean, you can tell they're not listening to what you're saying. They don't care about what you're saying. So this is what I meant by fragmentation. We are not talking to each other, we're not communicating, and we're, as a result, probably not going to be successful until we change this.